You're watching a segment of The Splash, Greater West Bloomfield's news magazine show.
For parents in and out of the community, knowing what's best for your child is always a priority. Genna Skalski gives us a pediatrician's perspective.
Dr. Hornick from Pediatric Care Corner in West Bloomfield has tips for parents who notice cold-like symptoms in their children.
I mean, at this point, mild runny nose, cough, fever, sore throat, your kind of general cold-like symptoms, which is why this is so confusing right now because it's still winter and we're still seeing colds and the flu, are kind of what you're going to be looking out for. So at this point, it would be safe to assume if your child has a fever, runny nose, cough, that they may have COVID-19, the coronavirus, and to self-quarantine at home for 2 weeks. Because at this point, we need to start to lower the amount of people that are getting exposed. And if people just keep leaving and, even going into their doctor's office without even calling, ahead of time where we can prepare for them coming into the office, then more and more people are going to be exposed, including healthcare providers, which then aren't going to be able to give care to the people that need it.
2 weeks of staying indoors can be hard for young children. However, Dr. Hornick has safe solutions.
I think, it's okay to do that, again, as long as you're not interacting, with other people. We may not want to be having kids playing on playgrounds and things like that because, the virus can live on surfaces for up to a couple days, if not cleaned appropriately. So, playing at your house, riding bikes, doing activities like that would be more what we are looking for. But it is okay to go outside of your house at this point. Especially because, in our area, we aren't in like a major, metropolitan city where everybody's like in apartments in New York City. We are in our houses, we have backyards, driveways, so kids can ride their bikes, things like that at this point.
The main reason for this quarantine is to make sure those with COVID-19 do not spread the virus to the vulnerable population.
According to most experts, the vast majority of us are going to be okay, but there's that vulnerable population, including the elderly and people with pre-existing conditions such as diabetes, heart disease, that are going to have more problems if they do get the virus. At this point, it's going to be hard, but people just need to stay in their houses. Even getting these like group gatherings, unless you don't have to, you really should minimize and just kind of stay to your family. So we're going to need to plan activities. A lot of the educational websites are offering free subscriptions to parents and kids right now while the schools are going to be closed. Comcast and some of the other internet networks are not going to shut off anything for 60 days, they've announced. So, it's going to be hard, but everybody's just going to have to kind of work together, bear with what's going on for the good of, the whole, to try to minimize what we're doing. And, the big kind of statement out there is flatten the curve, right? So we're trying to prolong, what's going on and people getting exposed and getting the symptoms rather than overloading our healthcare system at this point like you see going on in Italy.
Reporting for The Splash, I'm Genna Skalski.
To know more, you can visit civiccentertv.com/COVIDkids.
Thanks for watching this segment of The Splash. To watch the entire show or other segments, catch us on Comcast Channel 15 and AT&T Channel 99. Or look us up online at thesplash.tv and listen to us every week on 89.3 WBLD, the all-new Lakes FM.